Okay, so for the next session, we will have Miss Dipa Swaminathan. She's the founder of It's Raining Raincoats, with a talk from ideas to impact collaborative care. So a bit of background for Miss Dipa. She's the Harvard-educated lawyer, and she's the founder of It's Raining Raincoats, IRR. Sorry. Okay. She is dedicated in helping migrant workers in Singapore. In 2014, she encountered 2 migrant workers caught in a thunderstorm without rain cover and decided to take them home in her car and saving one from a suicide attempt. So this event led to a birth of It's Raining Raincoats in 2015, which has since grown from a team of 2 volunteers to over 1,500 and becoming a nationwide movement. The IRR has provided support to migrant workers during the COVID-19 pandemic by arranging meals, care packs, and even organizing art competitions and distribution of games and sports equipment. In 2022, IRR was registered as a charity organization and marked a milestone year with the opening of Inspire, a free store for the migrant workers to collect donated essentials items. So Ms. Dipa has been recognized with numerous awards and honors, including the President's Volunteerism and Philanthropy Award and the Inclusion in Tattalus Asia's 100 Most Influential in the Impact Space, as well as the Hero Award. The IRR has a small team of staff and a volunteer team of more than 1,500 members who runs a myriad of set of programs for the migrant worker. So in addition to that, she also busy with her job as a lawyer. Sorry, 1 second.
Hi everyone, thanks so much for being here and having me as a speaker. So I'm going to basically take you through the story of how I started It's Raining Raincoats, why the name. It's a bit of a puzzling name, so I always get questions about that. And also talk a little bit about what we're doing, some of the challenges we're facing, and you know, maybe you can find some ways to connect dots in your networks for us to help us out. So as was mentioned in the introduction just now, for which thank you, it all began in 2014. It's not like I woke up one morning and decided, you know, today's the day I'm going to start a charity. In 2014, I was actually between jobs. I work as a lawyer. And I was in between jobs, and I had the luxury of going to the gym one day at 11 in the morning, which you can only do when you're not working. And as I was driving back to my house, it was a pouring thunderstorm, and my windscreen wipers were going crazy. And through, you know, the corner of my vision, I saw these 2 guys stuck in the rain as I was, you know, driving to my house. They had no raincoats, they had no umbrellas, they were getting soaking wet. And so I drove past them thinking, oh, this is so sad, you know, I'm sitting here comfortably in my car and these guys are soaking wet. Something made me stop my car and reverse. So I came back, rolled down my passenger side window and insisted that they get into the back of my car. They were 2 migrant workers, these 2 guys. So they didn't know, you know, who this strange lady was, you know, was I trying to kidnap them? What was I trying to do? So they were very sort of reluctant, but I can be very persistent when I want to be. So I said, until you get in, I'm not going to go. So they got in very reluctantly. They had a road blower. They were road cleaners. So they got their equipment with them. They were more worried about the equipment than themselves. So they came in, took them home. I had a front, I don't live in that house anymore, but you know, we had a front porch. They sat there, gave them some hot coffee, something to drink, something to eat. I gave them a couple of my husband's t-shirts to change into because they were wet. They wore this after 3 hours and you can see it's still wet. So they just sat there quietly. You know, I got on with my sort of work. Then when the rain stopped, they said they were going to leave. So while they left, I took this photo of them. And because I took this photo, they asked me, what are you going to do with the photo? And I said, I'm going to put it on Facebook to say that if there's any employers sending workers out in the rain, they should at least give them a raincoat or an umbrella. You see, what happens is migrant workers, when they get wet, they can then get sick. It's not that easy for them. You know, I know you've heard about, you know, MCs and medical consultation, etc. But employers dock their day's wages if they don't show up for work. So very often they don't do that. And if they go to work when they're sick, that's when workplace injuries happen. So anyway, I was intending to put this photo up on social media, and they said, will we get into any trouble? Back in 2014, I think I had like 5 followers on Facebook, so it's not like anybody was ever going to see that post. But because they were worried, I tore off a piece of paper. I scribbled my personal mobile number and gave it to them and said, I'm a lawyer, and if you ever get into any trouble, you can call me. So they took my number, off they went. Did not hear from them again until 3 months later. I was shopping at NTUC in Bukit Timah Plaza, and was on the aisle with my cart when my phone rang, and it was the police. It was Jurong Police Division calling me to say that one of these 2 guys had tried to commit suicide the night before, and he had been arrested. Back then, attempted suicide was a crime, and the only number they could find on him was mine. So they were calling to ask if I would come to Jurong Police Division to post bail. His employer had gone AWOL. So when I heard that in this entire country, the only human being who could again come to help this person was me, of course I had to go. So I just dropped my shopping trolley there. You know, my husband was there, and you know, he's used to this, so I, you know, left it to him, and the kids were somewhere, had to be picked up, left everything to him, jumped into a taxi, rushed to Jurong Police Division, by which time they had moved him to the mental hospital, because that apparently is the protocol for suicide cases. So I had to go to IMH. It was my first time going there. It was quite traumatic for me. And by the time I got there, the guy who had committed suicide is a guy on this side, Murugan, the one without the beard. So they, he was in a ward, and the ward by now was guarded by policemen because Murugan is a criminal. But they allowed me to meet him. So I went and spoke to him. He had already grown a beard. He didn't look anything like this. He looked, you know, he looked just hollow eyes, sunken cheeks, just miserable. And when I asked him what happened, he said that he had not been paid his wages for 6 months, and he didn't know what to do, so he had tried to hang himself because his family was dependent on him to you know, send wages back. His employer was not paying him. He didn't know what to do, and that was his plan B, and he decided he was just going to end it all, and that had failed as well, and now here he was arrested. So I said, I'm here. I'm going to take care of things for you. So I left the ward, and I came out, and I spoke to the policeman guarding the ward, and I said, look, this guy is a victim. He's not a criminal. The real criminal is employer who hasn't paid him his wages. So you need to go after the employer and get him to pay the due wages to this man. But those policemen guarding the ward, I think, were like NS men or something. I know because my son is serving NS now, and he usually looks pretty blurred to me. So, you know, those NS you know, kids probably didn't understand what I was going on about. So I came back, Googled the email address to the Commissioner of Police in Singapore, and sent him an email saying all this. And I kept sending that email every single day saying, can you please release this man? Can you please get the employer to pay him his back wages, etc. A week later, I get a call again from the Jurong Police Division, this time telling me, Ms. Swaminathan, first of all, can you please stop emailing us every day? And second of all, we're calling to tell you that we've found the employer. We've got him to pay Murugan all of his due wages, and he's going to be released. So that was great news. And a week later, Murugan somehow remembered where I lived because he had come there once before, and he was there to thank me. He looked, you know, he looked good again. There was light in his eyes. His wife called me from India to thank me for, you know, saving his life or whatever. The employer was suddenly being very good to him because the employer suddenly realized this guy has some friends somewhere who are coming out to help him. So everything was good. It was a great ending to his story. He's now gone back to India. But it showed me, just that one incident showed me that with just a little use, I didn't do much. I mean, I just wrote a few emails. I just happened to be there at the right time. But just the use of my voice and my ability to communicate, I could really help these guys when nobody else is there to help them. Imagine if I'd not been there. I mean, I'm not saying, you know, it had to be me. I'm just saying if an individual hadn't been there to help Murugan, God knows what would have happened to him. So I decided I would just continue on my merry way, helping migrant workers wherever I found them. This was another sort of interesting story that happened a few months. IRR was still not born at this point. This is just Dipa going around doing her crazy things. But this was a day where I'd gone to drop my son to tennis. And as I was driving back, I saw these guys in the top photo. Again, rain, workers getting wet, doing work. And you can see what they're wearing, right? Garbage bags. That's what they wear, garbage bags as raincoats. And it wasn't even enough to keep them dry. Their supervisor, meanwhile, was standing under a bus shelter. He had an umbrella, and he was sheltered. But the workers working were wearing these very sad, torn garbage bags and getting soaking wet. So I stopped my car and asked them, which company do you work for? There were already cars honking behind me, but like I told you, I can be quite persistent. So one of them was quite clever. He just lifted up his garbage bag, and I could see the company's name on his T-shirt. So I took a quick photo of that, came home, Googled the name of the company, got a landline number, and called the number. And I said, I have photos and I have videos of your workers working in the rain. The videos part was a lie. I had no videos. But, you know, I'll say anything. So I said that. So the guy who answered the phone just slammed the line on me. I said, I need you to give them raincoats if they're working in the rain. So they just slammed the phone down on me, and now I'm thinking, oh my God, they have my mobile number, maybe they're gonna come and, you know, harass me or whatever. But the very next day, when I went to drop my son again to tennis, the same place, guess what I saw? The same group of workers, they'd been kitted out with brand new raincoats and rain boots, and they remembered me and my car, so they came rushing. Again, there were cars honking, so I couldn't take more photos, but I did take this one. It's the same guy from the one on top. And so I kept doing this on my own, and sometime later, one of these stories, you know, the Murugan story went viral on, I'll come to this in a minute. The Murugan story went viral on social media. Then the Singapore Kindness Movement reached out to me. Can somebody give me a show of hand when time is running out for about 5 minutes or so before? Yeah, just show me your hand and I'll wind up, and then I can also leave some time for questions. So yeah, so one of the stories went viral on social media. Then the Singapore Kindness Movement reached out to me and said, why don't you start something? And it was supposed to be a one-day activity. And they said, what can you think of? So I said, why don't we have an activity where everybody's walking around with disposable raincoats in their bags, and if they ever see workers working in the rain, they can pass it on. And they said, that's great, and we'll match it. So the number of raincoats donated, it's, you know, Singapore Kindness Movement will match it. What can you think of a name? So I'd heard the song It's Raining Men the night before, so I came up with It's Raining Raincoats, not realizing it's going to be a tongue twister. Nobody's ever going to be able to say it in a hurry. So now we're called IRR for short. But that's how It's Raining Raincoats was born. And then a few people reached out to me to say, hey, you know, we've also always wanted to thank our migrant workers. Can we join you? So then one person, me, became like 4 people, and then became 40, and then it's just grown and grown and grown. And we do a lot for migrant workers all year round. You know, we are now, so let me just fast forward to where we are now. So from that time, we are now a registered charity. We run Singapore's first and only free shop for migrant workers, where workers can come and take anything that they want for free. This includes both new and pre-loved items. So we connect, hi Bernice, one of our board members is here. So we collect new and pre-loved items for our migrant workers. This includes essential items like power banks, kettles, hot plates, luggage, raincoats, of course, umbrellas, you know, anything that they need. So it's a bit, you know, if you know anybody donating any of these items, you can always reach out to us. So we do that, and we have various other streams. We collect food from Starbucks. I'll tell you about that story in a minute. We do casework for migrant workers. We help them with dental and vision care, casework meaning disputes. They have a lot of disputes with salaries, et cetera, et cetera. We drop migrant workers to the airport because many of them live so far away in Tuas where there's no public transport. The nearest bus or MRT is 7 kilometers away. During the week, the employers ferry them by lorry to their work site and back, but when they need to go back to the airport, very many employers don't provide transport. So how do you get to Changi if you're 7 kilometers away from the nearest bus stop, and taxis won't even go there, and if a taxi goes there, it's going to charge $60 or $70. So our volunteers use their own vehicles, their personal cars, and pick up workers and drop them to the airport. So we do that. We have a youth wing called IRR Next Gen. We arrange meals for migrant workers. We call it Makan for migrant workers. We have a number of festive activities all year round. The next one coming up is Deepavali. So to keep in touch with everything we do, please follow us on social media. We're on Facebook and Instagram and LinkedIn. We also have a website. But before I go any further, I would like to talk about why we care for our migrant workers. So I'll just take you through the day in the life of a migrant worker. What many of you may not know is that many migrant workers still earn a basic wage of $18 a day. That's not $18 an hour, it's $18 a day, which adds up to $450 a month. And that basic wage has remained largely unchanged for over 20 years. Now, as you know, the cost of living in Singapore is nowhere what it was even 5 years ago. So you can't do much really on $450 a month. So then to make up, many of them work overtime. And if they work overtime, it means that they get no rest. They're working 7 days a week, and their job is not like some of our jobs. Like, I'm a lawyer. My day job is, I work on documents. If I get tired, the worst thing that can happen is a typo. For a migrant worker, if he's working on a construction site hauling glass and steel up a scaffolding and he loses concentration for even 1 minute, it could mean death, or it could mean a very fatal injury, or very bad injury. So that is the difference between what they do and how much they get paid. Then their living conditions, right? They live many men in a single room. Although we've heard about dorms changing, those are future plans. The existing dorms are still largely what they were during COVID and all the photos we saw, etc. So there are many men, and they share, many of them, like 50 or 60 of them share a toilet. So a day in the life of a migrant worker, they get up around 4:30 in the morning because they have to queue to use the toilet. If they can't freshen up and get ready, they'll miss the lorry that's going to take them to their work site, which is ready for them around 5:30 or 6 a.m. in the morning, which is why if you've ever driven on PIE early in the morning, it's full of lorries transporting migrant workers. So then if they miss that lorry, they'll get docked a day's wage because they can't afford a taxi to get to their work site. So then they get into the lorry crowded with other workers. They get to their construction site crowded with other workers. They take a break during lunch to eat the same meal that they get, which is usually a huge mound of rice with a little bit of curry or gravy on top. We know many migrant workers who are diabetic. As a result of that diet, their diabetes gets worse. They can't afford treatment here, and they're just sent back on a plane. So they eat that meal, back to the construction site, back to the lorries, back to their crowded dormitories. And all for building up beautiful hotels like this, etc. Imagine putting the finishing touch on a beautiful hotel like this, thanks to your labor and hard work, and then having to go back to that dorm room where you live, and that's your daily life over and over again, year after year. So that's why we believe that a little bit of compassion to these migrant workers goes a long way. It's just good karma also, I feel. They do a lot for us. We've got to do something back for them. And that's why we do everything we do. So who we are largely a team of volunteers, unpaid volunteers. We have a very small staff team, and I just want to talk about how hard it is to do what we do for the migrant workers as well, because we face burnout too. Like, I've been doing this now for 11 years. IRR is 9 years old, but I started, quite some time before that. And the compassion burnout, from dealing with every single case we get, it disturbs us. When we hear of a migrant worker dying and we speak to the widow and she's in tears, or we see the injury that a migrant worker has faced, or we see the unfair treatment that a migrant worker has had, and sometimes despite trying our best to help them, we've not been able to help them. All that load stays with us day in and day out, month in, month after month, year after year. So we as the volunteers who do this work also face a lot of load and burnout. So we always need help. We need help in terms of resources, we need help in terms of volunteers, we need help in terms of funding, any kind of help. If you can ever think of any kind of help, yes, 5 minutes left, you can reach out to me. My name is Dipa Swaminathan. I'm on LinkedIn. I'm very responsive. Or the SATA folks can, share my number with you. So we're always sort of looking for people. Sorry, is the 5 minutes including Q&A? Excluding Q&A. Okay, cool. So I'll just speak on for another 4 minutes and then I'll open it up for questions. And I love questions, and nothing is off limits, so please feel free to ask me anything that you would like to ask. So this is us volunteers doing, a lot of what we do. I haven't run through everything we do, but as I said, our social media feed is pretty active, and we also have a website which is up to date. I just also want to talk about, when I speak of the load of running a charity. When I decided to become a charity from just a ground up, I didn't quite realize how onerous all the all the compliance requirements and everything is. And we prefer to use our time and energy sort of focusing on the workers on the front end, but there's a lot on the back end as well. So, that's another area where I constantly feel like, we need support. And so these are some of the regular holiday events and seasonal activities that we do. So I've mentioned everything. So before I end, I'll just finish off with the Starbucks story, because that's another interesting story. So that happened again. My son was involved in all of these things directly or indirectly. He was playing a tennis tournament, and I'd gone to the Starbucks nearby at Sing Poly on Dover Road to collect, to buy Starbucks some drinks for the parents. And as I was standing there, it was 4 o'clock. They were closing because it's a uni Starbucks. So they were closing for the weekend, and they kept all the food outside because they were going to throw it away. So I said, if you're going to throw all this away, can I instead take it and give it to some migrant workers I saw outside just doing some road works? So they said, okay, sure, and very sweetly packed everything into bags for me. So I took it, and as I turned my car around, there were migrant workers doing road works. It was a hot Saturday afternoon. So I gave them all these muffins and pastries, and they were delighted because they can never afford such treats. And I took a photo of them eating it, and I put it on my social media, which had grown a little bit by then. And the post went viral. People thought this was Starbucks doing this for migrant workers, and they got a lot of people saying, oh, I'd stopped going to Starbucks, but I'm going to start going to Starbucks again now. They're so good. And they got a lot of positive publicity around this. So I took screenshots of all that and wrote to the Starbucks management and said, why don't you guys partner with us? Let's do this more often. Instead of throwing away food, you can give it to us. We'll come and collect it. You have to spend no money, and we'll give it to migrant workers. I got no response. So, going back to me being persistent, I then wrote an email to their worldwide CEO, Howard Schultz, and said this to him as well. And the very next day, there was a team from Starbucks at my doorstep with cold coffees for me, saying, how can we partner with you? So that happened in 2016, and we're still doing it today. So 8 years later, 52 weeks of the year, we have not missed a single week, and the number of outlets we collect food from has just grown. So that's how IRR has grown. It's been very organic, it's been very community supported, and the universe has guided us. And I hope the universe will continue to guide us on a path of growth. Yeah, it's been great presenting to all of you. So thank you very much for having me. Sorry, I meant to talk a little bit about health, but we never got around to it. But I just want to say that given that 1 in 7 in Singapore is a migrant worker, then the access for their medical care is really limited. We know it because we deal with them day in and day out. We just had one of our very beloved migrant workers having to go back because he had diabetes. He was told he had to change his diet to fruit and vegetables. There's no way he can afford that on his salary, so he just left with a huge loan still outstanding. So medical care for them is just, and dental and vision. I mean, imagine working with a toothache and it costs hundreds of dollars to go see a dentist. So, that's always a resource that we need. So we'd be happy to get any links that we can share with workers of medical care that they can access. Any other information, please feel free to reach out to me afterwards, privately, but I also welcome any questions now. Sorry, I couldn't go through all this, but I think I've spoken about, this is our new address, our free shop. If any of you want to take a screenshot, it's also on Google. We call it Inspire. And that is our number. That's that's not my number, but that is our store number. And yeah, this is our space. It's very colorful, very cozy for our migrant workers. And yeah, I'll end there. Thank you.
Thank you very much, Ms. Dipa, for the very inspiring stories. I would like to open the floor for any questions from the audience.
Don't be shy. I'm happy to take any questions. Yes.
I'm very glad with the job that you have done. Yeah, okay, I work for SATA. I think SATA, we try to do our best to help the worker as well. But sometimes we have a long list of patients, right? And if you know, like, I ever had personal experience that there is a patient comes and with the complaint of suicidal thought, and you know, we just don't know what to do. Can we refer this group of patients?
To us? Not to us, because we unfortunately don't have professional counselors or mental health, trained people to deal with workers who have suicidal thoughts. But I will say this, that for every migrant worker who's contemplating suicide, there's actually a very concrete reason why. And if that problem can be remedied, the suicidal thought will go away. It's not usually, I don't mean to generalize on mental health cases, but it's not usually like there is a physiological disease or a hormonal issue. It's usually linked to a specific issue, and that issue is usually money.
So I was thinking it's only probably they just need a pair of listening ear, but too bad that we have a long list of patients and just couldn't, and then we don't have social worker to refer to in our clinics, and it's not like polyclinics and they have social workers and all this.
Yeah, so we are, as I said, we are largely volunteers, but maybe you could maybe you could keep a record of such cases if you get it, and happy to. I'm just mindful that our volunteers are also completely stretched at the moment, and suddenly, if we start getting an influx of suicide cases, the compassion burnout and the mental load for my volunteers will also shoot up, because I myself have I'm seeing a therapist now, I'll be honest, because I'm just so burnt out that I myself find it hard to sleep at night. So I'm just mindful of the overall constraints that we're all facing. But it is something to maybe even discuss with your MP, because we need more people talking to more people in government. If everything is referred to NGOs like it's raining raincoats, it becomes a very narrow channel for it to go out from. So we need everybody to raise these issues with their MPs and their leaders to see how we can come together as a community to support such cases.
So I have a question for Ms. Dipa. So sometimes we encounter cases with our migrant worker. They said their employers are not paying according to their schedule, things like that. But for us, we don't know where to send the patient. We still can tell MOM.
Yes.
But that's about it. But what's the correct way of telling the patients?
Well, it is to tell MOM, and I say, I really would encourage all of you to even talk to your MPs about some of these cases, because they can escalate the, as a citizen or a PR, although the migrant worker can't go to a meet your MP session, you can as a citizen or a PR. So you can go and highlight to your MP that you've seen such a case and something needs to be done. That is usually a very good way to get some immediate remedy for that worker. But usually workers are also scared to write to MOM on their behalf, because their jobs can be immediately cancelled. Their work permit can be cancelled 24/7, which is why workers like Murugan put up with it for 6 months, because they're scared that if they complain, their job will be lost. Then and they can be sent back overnight. And many of them take a loan of about $8,000 to come here. It takes them 2 years even to pay back that loan. So it becomes like bonded labor, it's a really vicious cycle. So that's why, again, I say that everybody has to come together and speak up on these issues for some change to happen. Any other? Yeah.
Sorry, I think the other thing that puzzles me a lot, right, is about the dental services. Yeah, I mean the employer, they know that sending their employer to SWC, I mean the clinic that we are running is it's not going to help the workers. Yeah. The most we can do is just give them painkiller, and it doesn't solve the issue.
Yeah.
And health stuff, yeah, is the one that I always refer to, but as you can heard just now, Dr. Mo mentioned, it's 2 weeks wait. Yeah.
Yes. So what we do, and we've seen all this, trust me. So as a small charity, we are not health sub, we don't have millions. What we do is we've partnered with a few dentists, private dental clinics, who've seen a wrap up. Okay, let me just answer this question. So we've partnered with a few dental clinics. So we send the workers there for very, very urgent cases, and they charge them a subsidized rate, and we pay that subsidized rate. So this happens for workers who come to us. But again, I can't publicize this too much because our resources are also limited. So if you ever see a real emergency of a worker like crying in severe dental pain, please do reach out. We'll see if we can help. But like I say, I again don't want to be overwhelmed, you know. But that's what we do, because we've also tried sending them to health serve. The worker just bounces back to us. He says, you know, I can't see anybody, and he's dying with a toothache.